I am moving on to the Chinese lockdown. We have stories in the papers here suggesting that China is authoritarian for imposing a lockdown, and that people are very unhappy, and the British government is suggesting that this is unacceptable. I found this quite difficult to read because we had a lockdown here, and I couldn't quite understand why the Chinese lockdown was such a problem and our one wasn't. So I thought, who could I ask to speak on this? Well, Heiko Khoo is a sinologist, which is an expert on China, if you didn't know that word, a reporter on China, and also happens to be a rather prominent anti-lockdown protester from this country. He's been arrested 7 times. So as someone who's tied to China, I was wondering what he thought about China having lockdown issues. So this is what Heiko said in an interview. And we're going to speak to Dr. Bob Gill after this. This issue of the lockdown in China is really coming to the fore and is quite prominent in all the media. What's going on there? Can you tell us what's going on there? Also, could you say something about the vaccine that China's produced? And yeah, I mean, is this a really bad situation in China? What do you think is happening?
China went into lockdown on the 23rd of January 2020, and that was at a time when 10 million, out of a population of 11 million in Hubei, 5 million left the city. And the only area that was explicitly locked down was Hubei province, which is an area the size of Britain, but in a country, so about 65 million people in a country of 1.4 billion people. Much of China has never had a lockdown. So the news stories that are reported now that are saying China has been in lockdown for 3 years is not true. China spent a period, or better said, Hubei and a number of other areas locked down in January 23rd, 2020, and reopened in April 2020. And after that time, you might remember there were scenes of people celebrating, having parties, discos, bars, and all the rest of it, all around China. China sealed itself off like Australia or New Zealand did, and was supposedly then free of COVID until really the beginning of 2022. So for a period of more than a year and a half, China had de facto no lockdowns at all. 1 or 2 tiny areas, mostly around the borders with Russia, actually. So at the beginning of 2022, when China began to have some lockdowns, Shanghai was locked down for a while, and people began to see that and sort of say, oh, they're far too draconian. And the argument, of course, from the establishment in the West was the Chinese haven't got a good enough vaccine. So they need to take the Western vaccine. In other words, the mRNA technology that was developed by Pfizer and Moderna, I think Johnson & Johnson, or possibly the AstraZeneca, which is a gene-based viral vector vaccine. Now, the Chinese vaccine, from what I've researched, and because it's not just been used in China, if it was only Chinese data, you could turn around and say, well, the Chinese are lying. But there's data from other countries that have used the Sinovac vaccine, and there isn't a lot of reporting of adverse reactions to this vaccine. And this vaccine is a traditional vaccine. It's what we know from vaccines in the past. It's an inactivated virus, and it creates double immunity that appears as if you've been infected with a real virus.
A normal vaccine, right? Yeah.
Yes, but that doesn't. If you get injected with a Pfizer vaccine, it does not appear that you've been actually infected with a virus. So there are 2 types of appearance.
So I mean, the Pfizer one's a bit of a novelty. It's a totally new idea and hasn't really been used before, whereas the Chinese
it's
vaccine
a tried and tested technology. It's not a tried and tested vaccine.
Yeah, the technology is sort of brand new.
So according to the more recent studies of the impact of this vaccine, it has around supposedly a 90% efficacy rate if you have 3 doses. Now, of course, there's only a certain at-risk category, and are they really at risk is the question that your ordinary Joe Blogs in China asks. And your ordinary Joe Blogs in China who's supposed to be at risk, as we know the main category of people who are at risk, the risk ratio is very high amongst the elderly. So amongst the over 80s who have 1, 2, or 3 comorbidities, the risks can be as high as 10%. So we know this from everywhere in the world where they've done these studies, or certainly in the advanced industrialized countries where they did these studies. At China, that risk, my guess would be slightly lower amongst that group, mainly because that group have a different attitude towards health. Chinese attitude to health in the older generation is governed by traditional medicine. And traditional medicine treats the prevention of disease as the primary task of the individual and the doctor. So the main thing is you should eat well, you should have good nutrition, you should exercise your body, and if there are any known dangers that come with seasonality, then you should have prepared your body in the previous season. But if you didn't prepare your body in the previous season, then you should take certain herbs and spices and so on. So, for example, the authorities in China have never been able to extricate themselves from Chinese medicine. So, and this approach to medicine, China's medical system is always what they call walked on 2 legs. So they've got Western medicine and Chinese medicine.
Right.
So this is a paper from the Sichuan authorities published last month. And this is a technical guide for the prevention, this is from the government of Sichuan, of COVID-19 and of SARS-CoV-2. So how you stop yourself from getting coronavirus, according to Chinese traditional medicine. And it is 15 grams of mulberry leaves, 15 grams of chrysanthemum, 15 grams of almond, 15 grams of forsythia, 15 grams of mint, 30 grams of bellflower, 15 grams of raw licorice, 30 grams of reed root, and 30 grams of honeysuckle. So that's what the government of China, or the governments of China, this is Sichuan province specifically, but they are promoting through Chinese traditional medicine the use of these herbs and spices. And during the first period in China, they gave both Chinese traditional medicine and Western medicine, which in the case of China was hydroxychloroquine they gave them, which is forbidden to be used in the West, but it was used in China as the main antiviral medicine that they gave to people in the outbreak in Wuhan. So it's quite a different policy has been pursued.
But that's sort of that's quite democratic in the sense that it's listening to what people's tradition and culture is regarding medicine. It's not imposing that. It's sort of like going along with the historical medicine of China, isn't it?
Yes, and it's also
because people would people accept it if they were all told to take the Western vaccine?
That's the key question. This is an article from the Financial Times 3-4 days ago. And it says here, despite the Communist Party's enormous power of social control, ordering the elderly to vaccinate is viewed as a step too far even for Xi, because of fears it would spark, quote, dramatic social resistance. So in other words, they're scared, the old people, who are the bedrock of belief in communism in China, and many of them believe in communism, not in what Xi Jinping's doing, but in communism. They grew up under the culture, they grew up under Mao Zedong. They were people who experienced the revolution, the improvements in living standards, the arrival of barefoot doctors that provided healthcare, Western and traditional, to the population, improved their environmental circumstances, and thereby led to a huge rise in life expectancy in China during the period 1949 to 1980. That they consider, due to their actions, to their deeds, to the communist ethos, to the collectivism and the spirit which the people had at that time. And so they don't take rubbish. And if they're told to take something by their young children, a young child might come to them, I've been in the West, you should take an mRNA vaccine. they will just say no. And for the young child to insist on it to the older generation would be, it's disrespectful to the elder generation, as if they've got no knowledge, no experience.
Right.
And that's how it would be regarded. And therefore, any attempt to impose a vaccine mandate in China will cause an explosion of discontent.
I mean, just to move on a bit to this idea of lockdowns in general. I mean, you were opposed to lockdowns very early on in this country, and also you've sort of you just went out there and were kind of active talking about this, and to be arrested 7 times. Would you say there's an authoritarianism here that it's kind of hypocritical for the media to say how terrible China's regime is with lockdowns? I mean, if you've been arrested 7 times, what's your view on that?
It is complete and utter hypocrisy and nonsense. I mean, the British government to talk about, and the Americans to tell the Chinese, don't attack the protesters. These were the most brutal attacks on protests that I have ever experienced in the Western world. Protests were like at Speaker's Corner, the police would come in Roman formation, 80, 90 police to attack 5 or 6 people, Christians, Muslims, anti-lockdown, a few people gathering at Speaker's Corner to speak. On the 28th of November, 2020, just by appearing in Hyde Park and using a megaphone as I crossed Park Lane, I was dragged to the floor by 30 police officers, handcuffed behind my back, dragged into a van and incarcerated for 15 hours. Now, and first they took us to a processing center, which was the street next to Downing Street between the Treasury and the Foreign Ministry and the Foreign Office. And in that street, they had set up a special processing center where there were hundreds of people being processed after having been dragged out of the protest demonstration on the 28th of November in order to be given a fine. And then I turned around and said, well, you must give me a piece of paper proving you've arrested me. It was literally looked like a scene out of Chile, 1970s. And then when they refused to give me this sheet, then they arrested me again. So, you know, this was a complete insanity. And you know, all the circumstances that led to Sarah Everard's murder by Wayne Couzens, they were all associated with the increased powers which the police were acquired as a consequence of claiming to be enforcing public health. And in China, the people don't take shit. They rebel if they're confronted by this type of lower level bureaucracy imposing dictatorial powers over them. And that, to a certain degree, is what's happening now, despite the fact that many people think, rightly or wrongly, in my view, wrongly, that the lockdown served some beneficial purpose the first time round. Nevertheless, they will complain about the specific details. You see, a lot of people who joined the anti-lockdown movement in the West, they weren't supporters necessarily of Piers Corbyn or of QAnon or whatever else we were accused of being. They were people who've been confronted by these issues themselves. Small businesses that weren't able to open, petty bureaucrats coming and saying where your table can be and where your table cannot be, as if they had any knowledge themselves about what the health consequences of the in Hammersmith and Fulham, they had signs up on the lampposts, huge signs made of plastic with saying that cars should stay 6 feet away from other cars so that you don't spread, presumably between your exhaust pipes, spread coronavirus. It was, you know, a period of such madness that few people are able, you know, people knew some of these things were wrong, but they didn't know what specifically was wrong. So, okay, overall, we'll go along with it. And in China, that was also the case, but people are now they've got new lockdowns being imposed on them. People are starting to question it, particularly because the rest of the world has opened up.
Right, now, I wanted to discuss that further because I've seen comments, people not sure about what Heiko is saying. So I just wanted to ask Dr. Bob Gill. Now, the thing is that in the last day, it seems like the lockdown's been stopped because of all these protests in China. So the government has responded to that. But I wanted to unpick something about this vaccine thing. Do you think the Chinese vaccine is inferior to the Pfizer vaccine? And what did you think about what Heiko was saying about people who are reluctant to take vaccines and prefer traditional medicine? Is that a valid thing to do if you're a patient? To just, I mean, do you encounter that yourself?
Hi, Crispin. Yeah, I think that the first thing to be with these issues is to try and remain open-minded and avoid dogma, and question yourself, because my view on the pandemic and the lockdowns and the vaccine have changed as information has come to light. In terms of comparing the Chinese vaccine and the Pfizer one, I don't know too much detail about that. But what I do know is that the more we find out about the mRNA Pfizer vaccination, the more concerns I have. Now, friend of your show, Kailash Chand, whose son is a cardiologist, has done a lot of work looking into adverse events following the mRNA vaccine, and has published quite a long paper on it. I've put some links into the group. And it turns out that the raw data that Pfizer had from the beginning was estimating serious adverse events of a rate of 1 in 800. Now, this is unheard of for a vaccine, traditional vaccines, which take years to develop. And just look at the narratives that we were sold very early on. Get your vaccine to protect your relatives. Now, we know that Pfizer never tested the vaccine for transmission. So that was a big lie that was peddled by government and their scientists, that somehow getting vaccinated would give us herd immunity. But that's proven to be clearly untrue. And we were also told or led to believe that one vaccine would protect you. It doesn't protect you. We've had multiple doses of the vaccine, and we were told that it would stop transmission. So the lies and misinformation from government and the people who we're supposed to trust, these medical advisors, is now clear for a lot of people to see. So we need to start questioning the basis of any decision that this government makes. Now, I was skeptical from the beginning, but I never quite believed that the governments would act so blatantly against the public interest. But I know what they're doing to the health service. So the pandemic, in fact, and even the lockdowns turned into a bonanza for our financial elites in the country. We had a massive transfer of wealth under the cover of the pandemic. And the lockdowns, they affected who the most? They affected the small businesses. So you had a consolidation of fewer and fewer corporations in terms of their economic power. So lockdowns, looking back, were a desperate act. And I don't support lockdowns, in whichever country. I listen with interest on how the Chinese culture shapes how their government's working. But let's not forget, very esteemed person Jeffrey Sachs, he ran the Lancet panel on reviewing the pandemic, and their conclusion was that the origins of the pandemic were most likely from a lab leak in China, and the funding for that research was from America. Yet there is no public discourse about the origins of the pandemic, which have sent the world into economic crisis, has cost them millions of lives. So we should be questioning not only, we're presented with a very rosy picture of China. Well, why aren't they being honest about the origins of the virus? So the more we mustn't get into this sort of silo of thinking and not be open to questioning our beliefs. I've questioned my beliefs that I had at the beginning of the pandemic, and I've changed my view, and I am no longer providing any mRNA vaccine for my patients.
Wow.
Because the evidence of harm, particularly in the low risk groups, in children, they don't get any advantage and they don't stop transmission. So why are we vaccinating children who are healthy children? So another thing just to put across to you, Pfizer, massive American company, which has made billions upon billions in profit, have recently managed to get the Pfizer vaccine incorporated into standard childhood vaccinations in America.
Wow.
And what does this do? If your vaccine is included in that program, then you are protected from future litigation. So they have bent over backwards to ensure a mandatory vaccination for the lowest risk group in the population, for a group of people for which we still don't know the long-term consequences of being vaccinated. And just recently, I put in the link with the booster, that there's a system called the yellow card system in this country, which notifies adverse events from drugs and vaccines. We know that there's vast underreporting. From the booster dose alone, there's been 55,000 yellow card alerts. And from what I read very briefly this morning, there's been 2,330 fatalities. Now, why is this not in the public discourse? The other thing to contrast is we have, in October alone, we had 44,000 people waiting for longer than 12 hours in A&E departments. For every 80 patients waiting, the decision has been made they need to be admitted. For every 80 waiting over 12 hours, there's one preventable death. Where is the mass media coverage of this epidemic of preventable death that is taking place in our hospital A&E departments up and down the country? Why are we worried about China's lockdown when we're having mass preventable harm and death in our hospitals? It amazes me that, the theme of your show today seems to me how we are being distracted every time, how we're being distracted by the riots in Qatar, how we're being distracted by, racism, in people who work for the royal family. And this lockdown in China, I'm afraid, is another distraction. That's China's business. I'm not in favor of lockdown. We need to start questioning what's going on under our noses.